Akron Children's Pediatric Care Unit in Akron is expanding and modernizing treatment. Through this expansion, the pediatric unit is adding a dedicated heart unit where it will treat some of its most vulnerable patients. Akron Children's pediatric heart surgeon, Dr. Tara Karam-Liu, is joining me now to share more. Thank you for taking the time, Doctor.
Of course, you're welcome. Thanks for having me.
Now, how will this new expansion at the Akron main campus help to improve overall experiences, not just for the patients, but the families too?
Well, the first thing is that patients will be able to stay in their bedrooms for their entire stay. Many units, and in fact our old unit, patients were admitted after surgery. Obviously I'm a surgeon, so this is a bit surgeon-centric. They would be admitted to one room, and then oftentimes they would then move from an intensive care unit setting to a less acute setting on a regular ward, and sometimes they would move even beyond there. That makes it very disruptive for families and also subtracts from the continuity of care that we know is central to optimizing patient outcomes and patient and family experience. So this will provide a longitudinal place where families can essentially move in with their child for what will hopefully be a short stay, but will provide, I think, that continuity with their care team to optimize their experience. I think that's a key benchmark for us.
And we're showing some of the images on screen now of this new facility. What are the most common conditions in children that you treat within this unit, especially as of late?
Well, we treat the whole range of complexity at Akron Children's. We focus on neonatal and infant care, so we are a hospital that is all about kids. We don't do a lot of adult care except in very extreme circumstances. And so babies with complex congenital heart defects, babies with single ventricles, complex valve issues, there's really a expert multidisciplinary care team, and we leverage collaborative partnerships through the region to really provide the most excellent care for the whole range of congenital heart disease.
Are there any other improvements added to this unit to help with the patient care?
Yeah, I think that's a great question. So there's going to be a procedural room where we can, no babies like to have procedures, but where we can deliver that type of acuity and deploy it if necessary. There is a whole range of monitors and state-of-the-art equipment. The nursing unit really circumscribes the unit in a way to keep the most acute patients clearly in view. And then a particular fondness of mine, I think, there is a wonderful family space just outside of the unit where there's a whole kitchen and there's a really beautiful library to provide, you know, if you have siblings, a comforting space where people can go in what is often a very, very stressful time. So I think high acuity, state-of-the-art facilities, monitoring equipment, but also we've managed to make this space livable for families, which I think is really important.
Will this come in handy when we get into the upcoming flu and cold season too?
Yeah, that is a very prescient question. Obviously, we're coming on RSV season, and with the dedicated cardiac unit, we are able to keep the cardiac babies who oftentimes are specifically and particularly vulnerable to the deleterious effects of these lung infections. And so we can keep them separate from patients who may have community-acquired RSV and things like that, that will be in our general PICU. So I think that segregation is important, and it will also, of course, provide more space for those patients. So this will flex our space and give us a greater capacity in which to care for cardiac kids in a very, very specific way by the cardiac care team, which is most well-versed to care for them.
Doctor, thank you for joining us here at 5 to share more about this new facility.
You're very welcome. Take care now.